So depending on which state in which you live, you will get what's called a dense breast notification. So unfortunately in this country, not every state's patient is getting that letter, that if they do have what is called dense breasts, where you see more white on the mammogram, which is the degree of the fibroglandular tissue of the breast, then that notification of breast density should come to you depending on which state you live in. So for example, in Missouri, where I practice, dense breast notification law passed in 2015. So any woman who we categorize on a mammogram as extremely dense or heterogeneously dense, the two dense categories, these patients receive this letter about, you may have dense breast and you need to, if you have dense breast, you need to talk to your provider. So every patient will get some sort of notification, but obviously not all patients are going to have dense breast. So that's why it's important to have that discussion, with your primary care provider. Do I have dense breast? Now, a lot of patients are aware now that they have dense breast if they check what's called a portal. They check the portal and see the results, and then they can see if they have dense breast or not. But then there are some patients who don't have access to a portal as readily, or just don't check the portal, so they may not know about their breast density. We're going to be seeing over time, and very soon, likely, a sweeping federal legislation which will require each state to notify their patients of breast density. So like I said, in Missouri, we had a law passed in 2015. In Kansas, which is right next door, there is no law that currently exists. So we may have a patient who was on the Kansas side and didn't get any notification, but then come across the river to the Missouri side, and then all of a sudden, I didn't know I had dense breasts. So we need to correct that in this country. There's such a, the good news is that many more states now have that notification, but the states that don't, unfortunately, those patients miss out on knowing that information. So it's really important for patients to see their report, to see what their breast density is, because if it is those categories of heterogeneously dense or extremely dense tissue, then those patients may warrant additional surveillance in addition to mammography. And that sort of depends as well what their risk is. So risk is a completely different beast. There are many breast centers that will risk assess a patient. And if you're deemed high risk, regardless of what your breast density is, we do recommend additional surveillance in addition to mammography, typically in the form of breast MRI or ultrasound, alternating every 6 months with mammography. But if you're average risk, meaning that you're less than 20% lifetime risk for breast cancer, high risk is over 20% or above. But if you're average risk and below 20 and you have dense breasts, there are modalities that you can turn to if you want additional surveillance, such as screening ultrasound, such as a newer technology or sequence technology called abbreviated MRI or fast MRI, where it is like a breast MRI, but the sequence is truncated or shorter. We currently have abbreviated breast MRI at my practice. Our sequence to image the patient is 11 minutes. And we do this in women who are average risk with dense breasts. So again, knowledge is power. You have to know what your density is. And if you're one of those patients in the state where you're not receiving any notification, you need to, take it upon yourself to get the report, to see what your density is, and then from there decide what's best for you in terms of an imaging surveillance pattern.